This webinar is linked to the upcoming pre-Congress Symposium at the biennial International Health Economics Association Symposium to be held in Sydney in July. Since 2009, a group of researchers and policy analysts working on health markets in low and middle income countries have organized a pre-conference symposium at the biannual conferences of IHEA. The aim has been to encourage and disseminate high-quality research on the performance of these markets and on practical strategies for improving access to safe and effective services by the poor. The Future Health Systems Consortium is responsible for organizing this year's symposium with financial support from the Gates and Rockefeller Foundations as well as USAID through the SHOPS project. The objective of this webinar series is threefold. One, to encourage wider interest in issues related to private health markets and meeting the needs of the poor. Two, to deepen discussion on key topics that will be presented at the pre-Congress. And finally, to provide opportunities for those that will not be present in Sydney to engage in discussions. The webinar series is being facilitated by the Future Health Systems Consortium. But the webinars are being individually organized by a number of organizations, including APT Associates. Today's webinar is the third in the series. There should be 2 webinars scheduled for June, and the next SHOPS project-hosted webinar will be on health insurance to be held on June 6th. Just a quick overview of how today's webinar is organized. Following a quick introduction by myself, we will hear 2 presentations, one from Arunesh Singh and a second from Colm Fay, both of APT Associates. It will then be followed by a question and answer period, and we do encourage all of our participants today to submit questions and engage in discussion. To submit questions, please follow the instructions on the screen. There are 2 methods. You can send them via the questions box in the GoToWebinar control panel on the right, and also via Twitter using the hashtag HealthMarketMKT. Be sure to include your name, organization, and location when you submit your question. Before we begin with the presentations, I wanted to offer 2 quick definitions for today's webinar. The first is, what do we mean by a market-based model? The SHOPS project has been using these definitions. So we feel that a market-based model is a model that is scalable, commercially viable, and socially beneficial to the base of the pyramid or the BOP segments. By BOP, or by base of the pyramid, we are referring to the population segment at the base of the economic pyramid in any country. Our approach to market-based models has really been one to understand the landscape, to get a better sense of the range of promising market-based business models existing today in both Africa but also in other parts of the world. 2, to carry out research to identify barriers to scale and to long-term viability. And finally, to provide technical assistance to be able to support these promising models, document the support, and then share lessons learned around what works. I do want to say and give kudos to a SHOPS partner, the Monitor Group, who led much of our early work in this area. One of the biggest studies looking at market-based models was a co-funded study financed by Gates, Rockefeller Foundation, USAID, International Finance Corporation, Actis, and others that was led by the Monitor Group called Promise and Progress, Market-Based Solutions to Poverty in Africa. The study looked at 9 sub-Saharan countries, identified over 400 market-based initiatives, and conducted field visits and interviewed over 500 customers, distributors, as well as impact investors. The report is currently found on our website, but can also be found on Monitor's website as well, www.monitor.com. What the report found was that there were, in fact, 13 market-based model types, 4 with the most potential impact for health. There are 2 upcoming SHOPS publications with much more in-depth information on 2 of those health models that will be finalized shortly. The first is the direct sales agent models in health, and a second, the M-enabled inclusive business models report and applications for health specifically. These can also be found on the SHOPS website. So to begin, we will have 2 presentations today. The first by Arunesh Singh, who is based in India office. He is a senior program director for market-based models in India. His presentation is titled Reaching Base of the Pyramid Health Markets in India. The second presentation today will be by Colm Fay, who is an associate here at Abt Associates, but also a private sector specialist who is leading much of our work in challenge funds. And his presentation is titled Healthcare Innovation at the Base of the Pyramid, a challenge fund model for addressing the missing middle. Without further ado, I'm going to pass the control over to Arunesh, who will share his presentation with us.
Thanks, Caroline. My name is Arunesh Singh, and I welcome you to a short presentation on reaching base of the pyramid health markets in India. I will start with defining market-based partnerships for health. Such partnerships are defined as commercially viable partnerships between the commercial sector and other private or public sector actors in order to tap into and expand distribution, service delivery, and information networks to improve public health outcomes in selected areas. As a first step, let's understand the 3 primary barriers to entry into bottom of the pyramid markets or BOP markets in India from a consumer's perspective. The first being lack of access to quality products and information about products and services, which results in a barrier to adoption and use. 2 good examples to showcase the access barrier are oral contraceptive pills or OCPs. While 85% of rural women are aware of OCPs, but its use is only 14%. While various interventions have done well in achieving excellent awareness for OCPs, a sheer lack of access has resulted in low use. A second good example is of oral rehydration salts or ORS. Various studies have shown that awareness on use of ORS for diarrhea management in rural India is about 80%. However, lack of correct information about ORS has resulted in just 24% usage in rural India. Another significant barrier is affordability. While affordability in low-income areas sounds like a no-brainer, this barrier needs to be qualified further. First, highly subsidized or free products or services are often not valued by rural consumers. In addition, for high cost or high initial outlay items like water purifiers or cook stoves, the VOP consumer may be out of reach. Adjusting for the special needs of the VOP markets due to the regular cash flows or lack of resources will need to be addressed. Large MNCs like Unilever have understood this problem and have introduced small size and thus low price products for rural markets. For example, small sachets. Having understood the consumer barriers, I would now like to focus on key barriers that manufacturers and marketers face while addressing bottom of the pyramid markets in India. The first barrier is lower demand for health products and services, and therefore often markets need to be created. This lower demand exists due to the consumer barriers explained earlier, that is lack of access, information, and affordability. Secondly, there is highly fragmented demand among bottom of the pyramid markets. The rural VOP population is around 700 million people who live in 600,000 villages across India. What makes these markets more fragmented than is apparent is the fact that more than 50% of these villages have a population of less than 2,000 people. A final barrier that manufacturers or marketers face is the high discovery cost of entering VOP markets. VOP markets are not conventional and require a deep understanding before an attempt is made to invest in them. Having understood the barriers of VOP markets in India, let's now understand the profile of VOP consumers. The VOP market can be classified into two broad categories, namely 700 million people who live in rural India and 80 million urban poor who live in towns. While this is simple math, put together, these two categories add up to 780 million potential consumers in India alone. It is also interesting to note that public health indicators are significantly lower amongst the VOP consumers. As presented in the table, total unmet need for family planning for the urban non-poor is 10%. It is 14% for the VOP consumers. The same is true for any modern birthing methods, which are 21% amongst the urban non-poor, and it is more than half for the VOP consumers. I hope these examples provide a good insight into the differences in public health indicators between the urban non-poor and VOP consumers. In conclusion, if we want to make a significant health impact, it is important to reach VOP markets. To promote market-based partnerships in India, USAID funded two projects. The first being a 3.5 years project called Market-Based Partnerships for Health, which I will refer to as MBPH going forward. MBPH was followed by the Strengthening Health Outcomes through the Private Sector project, or SHOPS. This is an 18-month project focused on scaling up 5 successful partnership models. These programs or models are DIMPA, which has a focus on family planning, especially injectable contraceptives. The second is ITC Each of Our Health Initiative, which focuses on over-the-counter family planning and child health products. ORS Rural Health Initiative is the third model, which focuses on oral dehydration salts and child health. And the last is the Advanced Cook Stoves Initiative. You can see a snapshot of these projects in this slide, categorized by intervention type. We have conducted a wide range of work with different interventions, but due to paucity of time, I will focus on one model only to showcase how we have been able to overcome the barriers that I was speaking about earlier. For further information, kindly refer to our websites mentioned at the bottom of the slide. The model that I would like to focus on is the Advanced Cook Stoves Initiative. Advanced cook stoves are improved cooking devices that reduce emissions of smoke, cook faster, and consume less fuel in comparison to traditional cook stoves. The Advanced Cook Stoves Initiative overcomes the barriers of lack of access, information, and affordability by establishing commercial partnerships between a product manufacturer, a distributor, and a microfinance institution. Let's first talk about the manufacturer. The Advanced Cook Stoves manufacturer, called EnviroKit, provides competitive margins to the distribution channel, product training to the retailers, brand-specific marketing, and supply of the product till the distributor level. The distributor, called S-Smart, a company that caters to rural markets with a basket of products, including advanced cook stoves. This distributor manages the following processes: appointment of retailers at block-level towns. These block-level towns are small-sized towns that cater to a catchment of nearby villages. Rural consumers from these villages depend on this town for their various needs, like agricultural equipment, inputs, health needs, etc. These appointed retailers then appoint village-level entrepreneurs who provide dual services for creating awareness for advanced cook stoves by going village to village, as well as providing physical delivery of the product. By doing so, the model is able to overcome the barriers of lack of access and information. The retailer provides compensation to the VLEs, or village-level entrepreneurs, which is both fixed and variable, tied to the number of stoves sold and potential consumers met. Lastly, the distributor manages inventory, thus ensuring uninterrupted supply. The central vehicle of this model is the village-level entrepreneur, or the VLE, who works closely with the retailer. The VLE provides last-mile distribution and is also the person who interacts directly with the consumer. The VLE conducts meetings at the village where the advanced cook stoves are displayed, explained, and demonstrated, thus permitting consumers to experience the product. Based on this meeting, the VLE develops leads and then visits these families at their home to close the deal. The microfinance institution, a company called Sonata, plays two critical roles in this model: access to its client base, thus reducing discovery costs for the manufacturer. And secondly, the MFI provides loans with easy installments to those existing MFI clients who are interested in purchasing the advanced cook stoves. This addresses the affordability issue. The MFI, through its existing staff, is also able to monitor the VLEs. As a result of this model, VOP clients get access to correct information on advanced cook stoves. They also get easy-to-pay loan schemes for an aspirational product that has significant impact on their health. Having understood the barriers and the models implemented under MBPH in shops, I will now focus on the key lessons learned. One of the key lessons from both MBPH and shops has been the critical role partnerships play in addressing VOP markets. To elaborate on this further, partnerships that are cross-sectoral and leverage core competencies of each partner achieve better efficiency, both from the point of view of operations as well as commercial viability. The ACS initiative as explained earlier, ensures that each partner focuses on its core competency. That is, the manufacturer provides products at a reasonable price. The distributor provides last mile distribution besides creating awareness, and the NFI provides financing options. Secondly, such partnerships also enable risk share, the risk being high since BOP markets are new and unaddressed. This allows the commercial sector to explore new and difficult markets. Secondly, both MBPH and shops leverage distribution platforms to aggregate demand. Investing in the creation of a dedicated rural distribution network is challenging for health product or service companies, as is the case of large pharmaceutical companies. However, many non-health companies have created robust distribution platforms for the rural health market, like microfinance institutions, Unilevers, etc. An existing distribution platform provides cost-effective option for aggregating fragmented demand, as seen in the case of the model presented earlier, which provides the manufacturer an opportunity to gain entry into BOP markets. While retailers play a critical role in any market, for BOP markets, retailers need to play multiple roles, and hence a whole new class of retailers must be created. Retailers need to operate as dual service points. The last mile retailers bring health products to the BOP consumers, and they also drive interpersonal campaigns for products like contraceptives that require behavior change. They also need to be incentivized for both demand and supply functions as against traditional retailers. It is important to note that traditional distribution or communication channels do not reach the last mile, thus making it necessary to integrate demand and supply. Last mile retailers also require very careful selection, training, and support. The VLEs, or the village level entrepreneurs, in the Advanced Foodstuffs partnership are critical for the success of the partnership. Hence, clearly defined processes for their selection, training, and support cannot be ignored. There is also a need to optimize the basket of products. Due to low margins and low demand, it is difficult to make a viable business model through public health products alone. It is therefore important to have a secondary basket of easy to sell, high margin products that can contribute to the entrepreneur's profitability. In the ACS initiative, the product mix includes lower value, fast-moving products such as solar lamps. However, incentives need to be designed to ensure focus on public health products. BOP consumers need customized engagement approaches. A long-term and personalized engagement with consumers helps in addressing their concerns and build consumer confidence with both the product as well as the brand. High engagement, marketing processes that allows the user to experience the product are important. It is also important to customize the retailer profile to account for cultural and or product-related sensitivities. In the Advanced Bookstores partnership, a well-structured demonstration process allows for long-term personalized engagement where a potential consumer is able to experience and touch and feel the product via an actual live demonstration. The demonstration is customized separately for men, the decision maker, and women, the actual user, thus addressing cultural issues. In summary, partnerships that leverage each other's networks and retain focus on core competencies are more sustainable. BOP markets need a specialized class of retailers who deal in a basket of products and play the dual role of creating awareness and last mile delivery. And lastly, sales formats need customization for BOP consumers that permit experiencing the product. Thanks for your time.
Thank you, Arunesh. Today I want to talk a little bit about a financing model being managed by the SHOPS project, which seeks to uncover innovative health enterprises serving the base of the pyramid. Arunesh has described some scenarios where multinational corporations have successfully implemented business models that repackage their products or introduce new delivery mechanisms and distribution strategies for BOP population segments in India. As we've seen, there are multiple challenges and risks to be overcome. While the BOP market in Africa is substantial, with approximately 500 million people living on less than $2 a day, Africa has much lower population density than India, and consequently the economic potential is much more thinly distributed and much more difficult to access. As a result, it is much more challenging for multinational corporations in these markets to develop sustainable models that have the ability to reach scale. However, what is working in Africa is the development of business models designed from the ground up to serve BOP populations. These are new and growing enterprises that are operating in a very challenging economic environment and usually on very small margins. Not only do they need sources of capital that will help them reach scale, but they also need technical assistance and expert advice that will help them succeed. The SHOPS project has recently launched a challenge fund that is designed to uncover and support innovative health enterprises as one way to incentivize greater private sector involvement in improving health outcomes in sub-Saharan Africa. So what is a challenge fund? Challenge funds work on the idea that a donor issues a development challenge in terms of the impact or outcome that they wish to achieve. This is contrasted with traditional development approaches, where donors issue a request for a proposal that can be very specific regarding the mechanism or methodology through which these health challenges are addressed. The objective of the challenge fund concept is to promote innovation and to uncover previously unknown or untested approaches. Enterprises apply to the challenge fund with a proposal of how they would achieve the desired health outcomes or impact. Applicants are free to be creative with the technologies, approaches, or methodologies used and can propose activities that are aligned with the applicant's existing organizational objectives and strategy. Applicants then enter a competitive process where applications are compared to each other to select the best or most innovative approaches based on predetermined eligibility and selection criteria. Winners are then awarded with capital grants usually. So what is the missing middle? Many of these base of the pyramid enterprises at startup stage are often funded from a wide variety of sources. These are small amounts and allow the enterprise to reach pilot or proof of concept stage. When an enterprise gets beyond the startup stage, it may be able to access some donor programs. But these are often difficult for small enterprises to engage with given the programmatic and reporting requirements. Where many of these enterprises want to get to is the next phase, where they have access to commercial capital that allows them to scale their impact. However, without having invested in the systems and capacity to absorb investment from a commercial lender or an impact investor, these enterprises often don't look like attractive investments. This creates somewhat of a paradox. While there's a large amount of capital out there and there are many enterprises looking for investment, there's a disproportionately low volume of deals being done. This is because many of these enterprises have not been able to reach the point where they are considered to be investable opportunities. The question mark on this diagram is what has been referred to as the missing middle, the idea that there is a need for sources of financing that allow enterprises to bridge the gap between startup financing and larger scale investments or commercial lending. These questions we're hoping to shed some light on through the HANSHEP Health Enterprise Fund, which is a challenge fund for innovative health enterprises serving base of the pyramid populations in sub-Saharan Africa. The HANSHEP Health Enterprise Fund was launched in January 2013 in Ethiopia and Kenya. enterprises have applied for up to $200,000 in grant funding for innovations in service delivery, technology, partnerships, and business models. The fund is supported by USAID through the SHOPS project and by the UK Department for International Development through the HANSHEP Group, a multi-donor consortium focused on harnessing non-state actors for better health for the poor. The fund seeks to support enterprises that directly or indirectly contribute to improved health outcomes in family planning, reproductive health, maternal and child health, and HIV/AIDS. So what makes the HANSHEP Health Enterprise Fund unique? The fund differs from other challenge funds in three major areas. Of course, the fund provides capital to applicants, but it also provides substantial technical assistance in order to address capacity gaps within the organizations being supported by the fund. Secondly, the fund creates a platform for awardees to engage with investors early on in the process, and technical assistance is focused on increasing investor readiness among these awardees. Finally, the fund specifically focuses on those enterprises that have limited options to access growth capital, that are in the missing middle stage that we spoke about earlier. I want to talk a little bit about how we select the winners. The first selection stage is screening out those applications that are ineligible. For the HANSHEP Health Enterprise Fund, we require applicants to meet certain minimum criteria. Firstly, they must be revenue generating. This doesn't mean that they're necessarily for-profit organizations, because we're interested in the activities here rather than the legal form. And we want to make sure that the business model has the potential to be sustainable in the long term. The next thing that we need to be conscious of when we're awarding grants is that we're not undermining other available sources of financing. So we need to make sure that the applicants are enterprises that are in that growth stage where they need more than microfinance but can't yet access commercial capital or impact investors and don't have very many options open to them. Finally, we obviously have to make sure that the enterprises are contributing to improved health outcomes in the priority health areas that the donor has identified, are operating in the geographic areas that we're targeting, and that they are targeting the poor. In the second selection process, the selection committee will look at a more qualitative assessment of the applicants and begin to compare them against each other. Ultimately, the selection committee is looking for enterprises that have the greatest potential to achieve an impact that is scalable, sustainable, and replicable. So what kinds of organizations have applied to the Health Enterprise Fund? We have multinational organizations piloting low-cost healthcare devices. We have partnerships between multinational organizations and local manufacturers. We have social enterprises providing high-quality healthcare services in peri-urban areas, and faith-based organizations that are delivering revenue-generating health services to the poor. And we also have technology companies that are partnering with healthcare delivery organizations to pilot and scale low-cost IT systems and platforms. So there really is a wide range of organizations and partnership types, business models, and technologies that have applied to the fund. As well as agreeing technical assistance plans with each of the awardees, we will also agree monitoring and evaluation plans that will track progress towards operational milestones and focus on the programmatic activities proposed, as well as progress towards investor readiness. Technical assistance will be provided by local partners, regional experts, and SHOP staff globally that is focused on building capacity and implementing best practices in business management and service delivery from around the world. Many of the awardees will experience similar challenges, and there may be many opportunities to learn from each other. So the fund will provide a learning platform that allows the awardees to share experiences, resources, and challenges. This community-based platform will also facilitate greater interaction between the SHOPS project and the awardees and provide opportunities for other interested stakeholders, such as investors, to participate. Over the next year, we'll be sharing some of these insights and best practices with the global health community through the Health Enterprise Fund website and social media, and we hope you'll stay connected with the process as we learn more about how these models work to improve health outcomes for the poor. So in summary, market-based approaches in Africa can be challenging to scale. And the Challenge Fund model is one way to mitigate some of this risk. It incentivizes greater private sector involvement in BOP markets, but it's important to provide technical assistance as well as capital. And a key value add that the Challenge Fund model brings is creating an investor engagement from the start that creates a pathway to scale for enterprises that are awarded grants. Thank you very much for your time this morning, and I think we'll move to questions.
Thank you, Colm. And thank you, Arunesh, for your very interesting presentations. I encourage all participants to please continue to send questions in via the go-to question template or through Twitter. I'm going to start by asking our presenters to answer some of the questions that have already come through. Arunesh, we received a question from Terry Asoka of CareNet Nigeria. And the question is, how is this approach different from how multinational corporations are converting those at the bottom of the income pyramid into effective consumers?
Thanks for that question. This is a great question. The market-based partnerships approach is one of the means through which a commercial sector entity can tap into BOP markets. It is a lower investment approach as opposed to a direct and dedicated investment by an organization. What we have attempted to do is to demonstrate a number of models that could be used to reach the BOP consumers in different kinds of market situations. By sharing the knowledge gained through these demonstration models, we aim to encourage not just MNCs with higher investment capabilities to experiment in BOP markets, but also other firms that do not have the capability to invest in such experimentation, and hence the difference. I hope that responds.
Thank you, Arunesh. Okay. And then Colm, we received a question from Rob Yates of WHO. And his question is, in your definition of a market-based model, would an entity which is 100% publicly financed and solvent be classified as commercially viable, or does this assume some element of private financing?
Thanks, Caroline. That's a great question, Rob. And one of the things that we've obviously been looking at with the Challenge Fund is really, focusing on the activities that the organization is involved in. As you saw, we have a wide range of organization types and legal forms, and ranging from non-profit, faith-based organizations to multinational organizations. And they have a wide variety of funding structures and funding types. But really we're focused on, do the activities, the service delivery activities, generate revenue sufficient to cover operating costs? And for us, that's the key indicator of a viable, sustainable, and commercially sustainable model.
Arunesh, I think that you and your colleagues in India also probably have a perspective on Rob's question. Did you want to add anything? Okay, I'm not sure. I think we may have lost Arunesh for a second. So I will proceed to the next question. We received a really interesting question from Carl Manlin of the Global Fund. And Carl's question is, what could the enhanced role of the private sector be in the new funding model of the Global Fund? And this is actually a really interesting question, and I actually look to the participants to also add in some of their own perspective, and you can do that in the form of a question or a comment via Twitter. But I would say that for those of you who are unfamiliar, earlier this year the Global Fund did in fact release an announcement that they were changing the way that they were doing some of their funding for HIV, AIDS, tuberculosis, and other diseases in countries. And they really are looking to make more effective investments and moving away from the fixed rounds of grants and to a more flexible funding mechanism. The one thing I would note is that the new funding model, in line with the Global Fund's objectives, does encourage the engagement of a diversity of partners, including the private sector, not just the civil society, but beyond those. And I think that what we have found through our own work on SHOPS is that the private sector does in fact have a key role to play in the in addressing the HIV/AIDS needs in various countries. And I think we have had much success engaging the private sector in countries like Namibia, Ivory Coast, Kenya, etc. There is, and I hope that answers sort of my view of Carl's question, but I would like to sort of continue this discussion. I think that's a very interesting question. One more question, Colm, for you that has come through is in the design. This question comes to us from Cindy Sisek, and the question is, in the design of the HANSHEP Health Enterprise Fund, were there any lessons learned from other initiatives that helped shape the design of this challenge fund?
Thanks, Caroline. Yeah, this is an interesting question. There have been many other challenge funds for health and for other sectors in Africa and beyond, and some of those initiatives have involved ideas like community-based platform. For example, the Saving Lives at Birth Fund is doing some great work in keeping a cohort of awardees together and learning from each other after the awards. So really, over time, as we experiment with this model, and DFID has some great experience in running these types of challenge fund models in multiple sectors, and with that experience and over time, we're really kind of learning much more about how valuable the challenge fund model can be. I think what we've done with the Health Enterprise Fund, and a lot of this work was done again by our friends at the Monitor Group early on, is really bring together the best practices from multiple experiences and bring them together in one coherent approach that is sort of the different components are reinforcing each other. So we think it's the best of all worlds, essentially, and so we're really interested to see how those interact and how the combination of financing deep technical assistance, and probably deeper technical assistance than has been experienced in previous challenge funds, and that idea of community and investor readiness and bringing investors into the conversation. These are things that have been tried before, but they haven't all come together in one project or one initiative.
Thanks, Colm. Arunesh, there's a question that we received from John Davies, and the question is, how can marketers think like poor people?
Well, that's an interesting question, and there are two important factors for marketers to consider. I think the first is the poor have similar needs and aspirations as the non-poor. One should not do not focus on their assumed lack of ability to pay. We should focus on their aspirations. Secondly, to recognize that ability to pay issues are really cash flow issues, and innovative alternative financing options can address these. In fact, you can connect this to the slide from my presentation on the ACS model on slide 29, which speaks of the role of the MFI and positioning of the advanced bookstores through the PRIDE route. Thanks.
Thank you. There was a question that came in which comes to us from Tamsin Partnerships at Living Goods in Uganda. And the question is, how will the TA work within the Challenge Fund? In particular, what plans do you have to support organizations to share learnings with others? We at Living Goods would love to know how we can help by sharing the expertise we've built up, developing a network of community health workers doing direct sales. Colm, I think you can answer this question, but before we do, I did want to again recognize Living Goods and also mention that they, in fact, are one of the models that we did look at and include in our upcoming publication, looking at agent-distributor network models, a market-based approach. So I wanted to give kudos to them for allowing us to come meet with them. So Colm, do you want to answer the question around TA?
Sure, and that is a great offer to share your experience at Living Goods, and we'll definitely be making use of that. I think the core idea behind having a community platform for the awardees is, as I mentioned, to learn from each other because they're going through very similar challenges, but also to facilitate engagement with outside stakeholders. So we'll be putting together an online platform which will provide a space for the awardees to communicate with among themselves, but also to communicate with outside stakeholders through blog postings, through polls, through open forums. And so we'll definitely have a way for outside organizations to contribute to that. And that's going to be a very, very rich source of insight and experience from multiple base of the pyramid enterprises across Ethiopia and Kenya. And we'll be trying to sort of syndicate that insight and that learning through as many fora as possible, and trying to bring as much outside experience into that conversation. It really is starting a conversation around how can we take this model and learn more about it and provide the best kind of assistance and financing to bring these enterprises to scale, but more importantly to bring that impact to scale.
Thanks, Colm. We have a final question. I think we have time for a few more questions, so please get your questions in. They are coming in. Our next question is from Jeff Nezovich, who's actually, I think, helping us today with the webinar. He's from International Development Solutions, and his question is, health as compared to other challenge funds is a bit special. How have you worked to ensure that no harm has been done from the initiatives that you've supported? I'm going to ask Colm to quickly answer, and then I'm going to ask Arunesh to weigh in on the same question, but from the perspective of working with companies.
Thanks, Caroline. So really, what we're doing to screen or to assess these applications is bring in a wide range of judges on our selection committee to give a wide variety of perspectives, both from business and from health in Kenya and Ethiopia, and to bring our donors on board in that selection process as well. So we're really involving a wide group of stakeholders in assessing and vetting these organizations from the beginning. We'll also then be working with our own SHOPS colleagues from an M&E perspective to understand the outcomes and impacts that that these organizations are having as they implement the activities that we're funding.
Arunesh, did you want to add?
Yeah, thanks. One of the important considerations is that public funds are not used to provide an unfair competitive advantage to a commercial firm, and we want to ensure that we do that. So in the MBPH project, we have offered support to all interested organizations and ensure that the due diligence happens accordingly.
Okay. We did get a question wondering whether we had made final selection on our Challenge Fund grantees, and I can answer that we have not yet. We are still in the process of going through the procurement, but we hope to be able to announce awardees in early summer. Okay, so it is, let's see here, one more question is the Challenge Fund expected to be self-sustaining in and of itself? In other words, will investors see returns, both financial and social, that will keep the fund afloat, or will it be more or less a donor model with one-way financing for market-based enterprises? This question comes to us from Adam Lewis, from Rabin Martin.
Thanks for the question, Adam. That's a really good point. The Challenge Fund is funded with donor financing, and so the awards that we will be providing to enterprises will be grants. We are not expecting, therefore, any return on those investments. What we are expecting, though, is that applicants will be matching a certain portion of that award, either through additional financing that they may have access to, or more likely through in-kind contributions, such as technologies, supplies, staff time, facilities, etc. So it's not a return on investment model, but we will be looking for applicants to make substantial commitments in terms of what they contribute to the activities.
Thanks, Colm. So our final question for this webinar, and I apologize we can't answer all, but we encourage you to continue the discussion following the webinar. The final question is for Arunesh, and the question comes to us from Laurent Stan of JSI in the U.S. And their question is, what are the practicalities of engaging the private sector? And I thought that, given the wide range of commercial partners and private sector entities that our program in India has really partnered with, I thought you could provide us with final statements on some of the lessons learned and how, from your view, how easy or difficult it is to engage the private sector in these partnerships.
Sure. I think that's a good question, and given the work we've done, I could take a lot of time responding to that, and I'll make it as short as I can. I think the first thing is to notice that it takes time to identify the right partners, to lay out the parameters, and then actually find the actual partner, the right partner to work with. It's important to make a good business case. From our experience, there are a large number of partners who are interested in working in such markets, but it's really important that we are able to make a good business case. And once buy-in is obtained, it's very important to move fast. In a typical corporate, large-sized corporate, the expectation is that if a decision has been taken, it should move immediately. They typically have, one more intermediate step one of scale testing to ensure that the prototype can be scaled up. So if you're able to do this in stages as per the expectations of the corporate, it is definitely something that moves a lot faster.
Thank you, Arunesh. Thank you, Colm, for your participation today, and thank you to all of our participants on this webinar. I think we had a really good discussion. I continue to encourage you to send us questions via the Twitter or at info@shopsproject.org. I encourage you also to join us next month at the next webinar in this series, and thank you and have a good day.